Okay, this is Tori Novak at my clinical site here. This is video 2 for my midterm skills assessment, and this is going to be for the non-invasive ventilation. So what you're going to do first is we need to assemble all the equipment for the ventilator. So we're going to make sure we have our hands washed. Then we need to apply gloves. Okay, and then what we need to do is set up our vent. So we know that this is our patient side, which means obviously that the other side goes into the ventilator. We don't want it to be touching any surfaces at this point, so we're going to go ahead and kind of attach it up here so that we're keeping things as clean as we can. Okay, so we know which side is inspiratory and which side is expiratory based on the patient side. So the side that has the larger opening is for the temp probe. So we know that that's for inspiration. So I can plug this side into my inspiratory valve, which means that the other side is for the expiratory valve, and we do have a filter going back into the machine for that. We can use heated circuit with humidity. For this video, we will not be doing that. So I'm going to go ahead and attach all my pieces here on the end, so you can kind of see how I'm going to have this set up. So first of all, I'm going to show you MDI, I'm going to show you SVN, and I'm going to show you how to do suction. So the first thing that I'm going to attach is going to be this little T-piece. So the T-piece will attach to the patient side, and this is where we will attach our neb cup. So when you have the solution in your neb cup, you just push it into the T-piece, which raises a little lever, and that's how the particles will get to your patient. The next piece that I'm going to add here is for the MDI. So this is the MDI piece. It has a cover, and we'll talk about that later. And then I'm choosing to add this corrugated tubing. I was told by one of my preceptors that it's really important to use the corrugated tubing right near the patient interface side, because this corrugated tubing is much less rigid than, say, this here. So if the patient is not totally out and they move, this is going to be a lot more gentle on the system than if they're pulling against a rigid piece of plastic. So although it does add a little bit more dead space, they have told me that they still feel that this is a good option to add because of that mobility. That way hopefully you won't have patient disconnect accidentally due to that movement. So I'm going to choose to use this piece of corrugated tubing as well. And then the next thing that I'm going to add on to the end of this is my suction catheter for the inline suction. So this end right here is the end that's going to go attached to my ET tube, which is inside of my intubated patient. So first I'll talk through the MDI and the SVN and the suction, and then I'll go ahead and set my controls given to me by you. So first of all, we'll just go ahead and do the SVN. So you go ahead and go like this, you can see. So you have your neb cup, and you go ahead and fill it with your medication that your patient will be using. And then, like I said, it just slides up into the T-piece where it opens up into the inside there, and that's how the patient's going to get the aerosol. So you're just going to attach, just like you do when you're doing a treatment, you can attach this to wall air, turn it on to 8 just like you would normally for your patient, and then your patient will get the medication from the SVN. Now, in order to help reduce dead space as much as possible, when we're done with the neb treatment, we can just remove the cup, and then we can cap it off. So that is how you do the SVN portion. Now for the MDI, you remove this little cap at the top, and what you'll actually do is you'll remove the canister from your MDI. I'm just using a practice MDI, so there isn't a canister, but what you would do is you would remove that canister, and then there's that little there's a little piece at the end that fits into the bottom, which when you push it is what administers the dose. So you just set that right into there. There's a little hole for that, and then for demonstration purposes, so even though it wouldn't be in this outside container, you'd put the canister on top and you would administer your doses. So if it was 1 dose, 1 spray, 2 doses, 1, then you wait, 2. Making sure that you were still shaking in between if you had more than 1 dose. And then again, when you're finished, you just go ahead and close that off there. And that's how you do the inline MDI. Now, if you're gonna do inline suction, you're gonna have this end attached to wall suction, and you wanna make sure that your suction's working. This type of suction, you can lock it, so you wanna make sure that your suction is, that your suction's ready to go. So when we do inline suction, you're going to just go ahead and insert the, you can kind of see it in there, you can see the black line moving. So you're going to go ahead and insert the suction until your patient coughs, or gags, and then you're going to go ahead and suction on the way out. You do need to make sure though that on the way out that you pull the suction all the way out of the way so that it's not blocking the airway. Otherwise you're going to have increased airway resistance, and your ventilator might tell you that there's a blockage as well. So that is how you do the inline suction, the inline MDI, and the inline SVN. So now I'm going to go ahead and set my parameters on this ventilator. So anytime you use the ventilator or the BiPAP, you do need to make sure that it's always plugged into the red outlet. That way it's hooked up to the backup generator should you have a power outage. These people need these devices, and so it's really important that we have a backup plan should we need one. This guy's sitting here, but he's not part of this video, sorry. Okay, so I'm gonna kind of move things around here just for educational purposes so that you can kind of see. And I'm gonna bring this up closer now. Mind you, I do not have this trigger hooked up to the air or oxygen, as I don't have it readily available, so we will have alarms going off for that, but we know that that's just part of it. So we're gonna go ahead and get started. So to turn on this ventilator, we have a power button right here. The green light comes on, and it just takes a couple minutes here to power up. There we go, it's getting started. I just do want to point out for a moment that anytime you're using any type of ventilator, you need to make sure that you have your ambu bags readily available should you need it to manually ventilate your patient. So we do have those there and ready. Okay, so the device is powered on, and it's asking us if we want to use a current patient or a new patient, new neonatal. We're going to just choose a new adult patient. And then we just push this button for enter. Okay, now we're in standby. The patient's not ventilated. This is giving us the opportunity to set our settings. So to do that, we want to be in volume control. So we're going to go to ventilation settings, and we're going to choose volume control, and we're going to set our settings. So the first setting we need to have is tidal volume. So we're just going to click the tidal volume, and we're going to dial it back to 500. And then once we're where we need to be, we just push the button to enter. We want our respiratory rate set at 16. So again, push 16 and push to enter. We want our FiO2 set at 60, and that is set at 60. Our PEEP set at 5, and our PEEP is set at 5 there. And we want our inspiratory time to be at 0.8 seconds. So we'll go ahead and turn that back. and we'll enter. And that's how you enter in the settings for this patient. So then we're gonna go ahead and what we would do is start ventilation. So we have all of our settings set. We're in volume control. The patient is on an ET2. Our FiO2 is set at 60%. Inspiratory time is 0.8. Respiratory rate is 16, and our tidal volume is 500 with a PEEP of 5. So we would go ahead and start ventilation. It wants me to do a device check and a breathing circuit check. So you start now my alarms are telling me that I don't have oxygen or air, which is true because I don't have it hooked up to oxygen or air, and I don't have this hooked up to my patient. But as you can see, it would show you your volume, your flows, and it has all of our settings down at the bottom. So besides the fact that we don't have the oxygen on and the air supply on, that is how you would set that up for ventilation with those settings for a patient. Then to power off this device, I'll go back here. So you're going to push power. I'm going to go to standby. We're going to go back to standby. Okay, so we're in standby. Now we're going to shut off. Now it wants to make sure you shut off. It does that because they don't want you to accidentally shut off ventilation on your patient. So it asks you twice, and the answer is yes. We want to confirm shutdown. And then again, enter, and then it's going to let the system shut down. So that is how you set up the settings on the Draeger 500 Infinity. That's how you do the SVN, the MDI, as well as the suction on this type of system.